Hello, everybody. Thank you for the introduction. Also like to thank the organizers for accepting our abstract. My name is Mihai Lixandru, and I represent the Romanian Association Against AIDS, which is one of the largest NGOs in Romania and the leading NGO working in HIV/AIDS. And we are the ones who work with most of the key groups in Romania. So that's why we also have the lead in PrEP, introduction in Romania. Hopefully it works. Yeah, it works. I have no conflict of interest to disclose. Just to give you a small background on the local environment, Romania has a national HIV strategy which has been adapted in 2022. Unfortunately, the biggest part of the local strategy, which is prevention, has no budget. This applies also to PrEP, and still to the moment. We have good news for 2026, but still we were waiting to see implementation. We do have access to generic PrEP, which makes quite accessible cost efficiency rate for PrEP. And Romania has been and is officially using the EATG guidelines, which includes PrEP. So we have all the legal framework. How it started in 2023, ARAS, with the support of the Elton John AIDS Foundation and in partnership with the National Institute of Infectious Diseases in Bucharest, opened the first PrEP center under the name of PrEP Point ARAS Bucharest. This being part of a project, we had constraints which were imposed by the donors, which was to target people at risk and specific categories. And still to date, most of our clients come from this group. So the PrEP Point was targeting GBQ-MSM, transgender women, and non-binary people who were assigned male at birth and were already at risk. What meant already at risk meant unprotected intercourses in the past 3 months, an STI in the past 12 months, people from sero-different couples with a partner having a still detectable viral load, using post-exposure prophylaxis at least twice in the 12 months, people involved in transactional sex, people involved in chemsex, or attending sex parties that didn't involve the use of drugs. So as I mentioned, this is a partnership, and it's a unique partnership for Romania, which was public, civil society, and private donors. We needed, of course, the medical field, which means the institute in Bucharest, who provided the specialists who followed medically all the patients. And we also needed the hospital for the pills-related components, which was acquisition, storage, and issuing of treatment, even if the funds came from the project. But the PrEP Point, it's a community center. It is led by community, and at least the one in Bucharest, it is in a community placement. We offer the both ways of taking oral PrEP, which is daily and on demand, and it's an integrated service, meaning a one-stop shop. So they do not need to go to different other places. The doctor that works in the hospital comes to the center, and everything takes place in the center. One thing that I have here, a mark not to forget, is something that I didn't include it. Our center works only 1 day per week on Wednesdays, so today I will have to leave at some point, because at 5 p.m. to 9 p.m. we have our program with clients. The model in Bucharest has proven to be successful. That's why since 2023 and 2024, we replicated the same model with our second PrEP Point, which is in Cluj-Napoca. Some people would say the second largest city in Romania, depending on what you are seeing, like number of population or the growth of the city. So we opened this second center, which is again a partnership with a medical institution, which is the Clinical Infectious Diseases Hospital in Cluj-Napoca. And here it is still led by community, but because we didn't have the space there, the hospital provided the space, so the center is situated also in the hospital. And based on the same model that we have in Bucharest, it's also on Wednesday. So This model comes from our checkpoints. We have also 4 checkpoints. We want to create a national understanding on when it is available and when you can go there without having to check schedules. How it works for us, people schedule an initial visit where they have received counseling specifically related on PrEP. We do rapid testing for HIV, hepatitis B, C, and syphilis. The doctor does a clinical evaluation for gonorrhea and chlamydia. As I don't know if you know, Romania has very few to almost none access to 3-sided testing for gonorrhea or chlamydia. And when it is available, it's quite high cost. So it's not really available. So that's why we do recommend testing only when symptoms. It's not ideal, but this is the environment we've been working. The doctor also evaluates the medical history of the patient, meaning all previous historics and medicines that they are taking. We do collect blood for HIV, creatinine, and urea, a little bit over the guidelines of WHO that you will hear after. And the pills are issued 1 week later. Why is this? Because we cannot take out medicine from the hospital without having the person registered in the hospital. This means GDPR. If I don't have the signed paper, I cannot take the drugs before seeing the person. So again, we are working in an environment with the legislation that we have. So the scheme that you are seeing here is for daily PrEP, meaning that after 1 week visit, they receive 30 pills, which means the person has to come back in 1 month when we repeat rapid testing and issue PrEP for 2 months. Then the person will come every 3 months and we will repeat rapid testing, a clinical evaluation, and do lab testing, and they will get pills for 30 days. The difference between daily and on-demand is that we don't have actually the 3rd visit, which becomes every time they need pills, but not later than 3 months. So they are issued 1 week after initial visit 30 pills, and they come back when they need more PrEP, but not later than 3 months. So at least every 3 months, we want to see the people coming to our center. So data here is from November 2023 till 2023 till August 2025. We had 369 individuals enrolled in PrEP who received at least once PrEP. 57 of the people, or 57%, which means 207 participants have chosen the daily administration program, and 43% opted for on-demand. 132, which amounts for 36% of participants, have stopped using or were using inconsistently PrEP and didn't come for the scheduled visits. We had a very strict number of people that we were able to offer PrEP initially. So when people were not coming to the visit and didn't let us know, or they didn't have a clear reason for missing, they were excluded and other people were taking their places. As you will see, this was covered by the project and it was for free, and it was the only project which delivered PrEP in the country. That's why we were quite strict to not save spaces for people who didn't come to visit. In August 2025, we had 227 people enrolled, and in a future slide, you will have also one of the reasons of the 36% drop in clients until August. And I will come back to it. The profile on the clients based on the risk, 99% of the clients were GBQ MSM, the other 1% were either transgender women or non-binary people. 38% of them engaged in chemsex or attended sex parties. All participants have engaged in the past 3 months in unprotected sex. 10% of them have accessed PrEP at least twice in the previous 12 months. 1.5 were people from different couples, again, partner with detectable viral load. 3% were engaging in transactional sex. 23% had an STI in the past 12 months, and 50% of them had previously taken PrEP. Here we include also people that have been included in previous studies that we have conducted also in partnership with Matei Balch Institute and the Clinical Infectious Diseases Hospital in Cluj-Napoca, or people who are using PrEP from abroad or order on the internet, what the French call sauvage PrEP. Seroconversion, even if it's not the best title, because we have also initial visit. We have 2 people who are diagnosed at the initial visit. 1 person who seroconverted at 1 month visit, but he didn't take the PrEP during that month. He had some belief that he may have had exposure. Also, the results of the lab testing for HIV was quite close to the 1 limit, and he actually was positive at the 1 month visit. No seroconversions during PrEP use in the period that we analyzed. We also had 2 cases, one for hepatitis C and one for hepatitis B. And during follow-up, 18% of people were diagnosed with syphilis. All cases have been linked to treatment and care, of course, because we are partnering with the hospitals. This is one of the reasons of the 36% drop. It is that, again, this was financed by a project which had also the idea of the government to finance. This was not happening. We were approaching the end of the project, so what we did in order to ensure sustainability of the project is introduce a copay, which is around 90 euros for daily PrEP, so 90 euros every 3 months, or 55 euros for the daily visit. When we did this change, it was 1st of January 2025, and we had an 89% retention rate, but again, we lost. This is not ideal. It becomes quite an exclusive program for people who can afford it, compared to the costs of, for example, a pack of cigarettes is not very high. But again, is limiting for many people. Additional services that we provide in the PrEP point, it's hepatitis B vaccination. We vaccinated 114 people with at least 1 dose at the moment when I created the abstract. Vaccination was offered part of the time for free because it was part of another project. Then we continued to offer it for pay. We offer HPV vaccination, which it's quite expensive for men, because the national guidelines have changed since 1st of October. We extended from 18 to 26 for males, but after 26, it's 100% pay, and it's quite expensive. So 1 dose of HPV vaccine, it's 150 euros, and of course you need 3 of them. What we do is offer 1 dose for free, but actually we subsidize which one of the 3 doses that they get. We also have introduced DoxyPEP on prescription, and we can perform any lab test that may need because we have a partnership with the laboratory. And of course, if it's recommended by the doctor. I extend my sincere gratitude to all our clients because they trusted us and because they have been understanding with us, because it was very new for us also, so we needed to adapt. I would like also to thank my colleagues from the PrEP points in Bucharest and Cluj, also my co-authors, Dr. Luca Pătrașcu, which is also here, and also special thanks to the Elton John Foundation that gave us the opportunity to start this work in Romania. Thank you.